Well, hello there, friends and family. It's good to see you all again. I know it's been a few days since I posted the last video, but where I wanted to start today, and what I wanted to talk about, we have to go back in time. And what you're looking at now is the Johns Hopkins website that tracks the coronavirus. This is not the current numbers. This goes all the way back to January the 30th. 5 days after I actually did my very first video. And why I wanted to show you this here is about what we're going to be talking about today. And what we're going to be talking about today is, when is a pandemic a pandemic? When did we decide to declare a pandemic? Obviously, not yet. And we'll go more into that as I continue. But like I said, this is on January the 30th, 2020. You can see the total cases confirmed back then was only 8,236. And we only had 171 deaths. And over to the left as well, you can see there was exactly 11 different countries that had confirmed cases. And you might want to look at that, because we're going to be looking at where we're at today. It's a much different situation today, and that's where we're going to be asking the question again. When is a pandemic really a pandemic? So stay with me, folks. So where we're at now is we're at the World Health Organization, which we'll refer to as the WHO from this point forward. And this is the WHO's pandemic phase descriptions and main actions by phase. And why I want you to understand this is so you can understand where we're at today and why things are not happening or happening as they should. So let's look at phase 1. There are actually 6 phases in their pandemic phase descriptions. And phase 1 is basically no animal influenza virus circulating among animals have been reported to cause infection in humans. Now, as we go through this particular pandemic phase description, you're going to see a lot about influenza. And that's because the WHO or the U.S. or any other country really doesn't have a pandemic description for infectious disease or viruses in general. What they have is for a pandemic influenza outbreak. And this all stemmed from the 2009 H1N1 swine flu epidemic that spread across the entire world. So, here in phase 1, like I said, it's basically no animal influenza virus circulating among animals has been reported to cause infection in humans. Basically, every day, nothing's happening. Phase 2, an animal, and I'm just going to skip the influenza part and just go virus, because we're talking about coronavirus here. An animal virus circulating in domestic or wild animals is known to have caused infection in humans and is therefore considered a specific potential pandemic threat. So now we're at phase 3. In phase 3 description is an animal or human to animal reassortant virus has caused sporadic cases of small clusters of disease in people, but has not resulted in human to human transmission sufficient to sustain community level outbreaks. Well, as I showed you in that Johns Hopkins website screenshot, we were already at a phase 3 on January the 30th. And what I want to say about that is, we were actually at that prior to January the 30th. I can only confirm where we were at by January the 30th and provide a screenshot, because that was the first day I decided to take a screenshot of the Johns Hopkins website. I really wish, as this has progressed, that I had taken a screenshot at least 3 times a day, every day, throughout the coronavirus outbreak. I really think that would have gave us a lot of information on how this has gotten to where we were to where we are today. But now let's look at what the WHO should have been doing during these 3 phases. Now, in planning and coordination here, it's in red. Develop, exercise, and periodically revise national influenza pandemic preparedness and response plans. And before I continue with what they were supposed to do, let me tell you this. I've watched every press conference they have released. And I've watched them even though they have been far less than informative and very painful and frustrating to watch. Basically, they've been nothing more than cheerleaders for the Chinese Communist Party and how they've been handling their epidemic in their country. Enough said about that. Now we go over here to situation monitoring and assessment, which is in blue. Not sure why the colors are here different. Maybe that's because what they feel is most important and less important. And here they were supposed to develop robust national surveillance systems in collaboration with national animal health authorities and other relevant sectors. Nope, ain't heard nothing about that neither. Communications. Complete communications planning and initial communication activities to communicate real and potential risks. Nope, that ain't happened either. Reducing the spread of the disease, and this is something that's very important, and I'll elaborate on. Promote beneficial behaviors in individuals for self-protection. Plan for use of pharmaceuticals and vaccines. Now, something I want to say right here. On the January 27th, which was 3 days prior to that screenshot I showed you from Johns Hopkins University's website, they came out and they were adamant about this, that they did not support or recommend any travel bans or restrictions to China or other countries that had confirmed cases at that time. They didn't feel it was necessary, and they didn't feel it was advantageous to curb the spread of the coronavirus. Fast forwarding to current time, they still have not declared or recommended travel bans or travel restrictions. They just haven't. And what they came out with Saturday was an unprecedented, first time ever during this outbreak, press conference. But the reason for that was they didn't want shipments of medical supplies that were being sent to other countries to be stopped or halted because of air travel restrictions. Now that's just incredibly stupid. There's a difference between banning passenger travel between countries and banning critical supplies to countries that have outbreaks or epidemics. And then lastly, continuity of healthcare provision. Prepare the health system to scale up. Nope, not a word. Not even of a Saturday. Not a single word of what their plan is. Why? Because they don't have a plan. So now we're going to take a look at phase 4. So in phase 4, you have human-to-human transmission of an animal or human-animal reassortant virus able to sustain community-level outbreaks has been verified. Now I'm going to switch you over to a screenshot that I made on February the 3rd, okay? And we're going to take a look at that right now. So here's a screenshot I did of that same Johns Hopkins website on February the 3rd, and this was actually done per video I released on February the 3rd of what we knew at that time for certain. You can see right here, the first bullet statement, human-to-human transmission. And this had been verified by the Chinese a week or more earlier to February the 3rd, but had yet to be confirmed by the U.S. CDC. As of February the 3rd, even the U.S. CDC had admitted that indeed human-to-human transmission, not only in China, but in other countries, had been confirmed. So let's take a look at what was supposed to be happening on February the 3rd. And you can see the numbers here right now. On February the 3rd, we had 17,485 confirmed cases. You can see the countries here, and this is not all of them. It's just what I captured. And then you can see the total number of deaths was at 362. But let's switch back and take a look what the World Health Organization, the WHO, should have been doing at that time. So at phase 4, the WHO is supposed to be, as far as planning and coordination, they're supposed to direct and coordinate rapid pandemic containment activities in collaboration with the WHO to limit or delay the spread of the infection. Now here again, just like I told you previously, the WHO has, as of yet, to not recommend or advise travel restrictions of any kind. Thank God the U.S. and many other countries didn't even heed that and went ahead and put in place bans to travel not only to China, but from China. Then in situation monitoring and assessment, they were supposed to increase surveillance, monitor containment operations, share findings with WHO and international community. Now they may be doing that, but the press conferences don't say anything about that. As far as communications, they were supposed to promote and communicate recommended interventions to prevent and reduce the population and individual risk. Not a word, folks. They haven't recommended squat. Reducing the spread of the disease. Implement rapid pandemic containment operations and other activities. Collaborate with the WHO and the international communities. No. There is no plan, as of yet, February the 23rd. And they were supposed to activate contingency plans. Well, nope. As of this Saturday's press conference, no mention of contingency plans, what they might have been, what they're going to be, or when they'd be activated, because the WHO has, as of yet, to declare the coronavirus pandemic. So then we come down to phase 5. The same identified virus has caused sustained community-level outbreaks in 2 or more countries in one WHO region. Well, as you saw on January 30th, we had it in 11 countries. I can't remember how many I showed there on February 3rd, and I understand that wasn't all of them, but it was definitely in 11 or more on January the 3rd, or January the 30th, pardon, and even more on February the 3rd. Now, we're going to take a look at phase 6. In addition to the criteria defined in phase 5, the same virus has caused sustained community-level outbreaks in at least one other country in another WHO region. It's been in more than 2 countries. It's been more than 3 countries since even prior to the screenshot I showed you on January the 30th. But here again, as of February the 23rd, the WHO, the World Health Organization, has yet to declare this coronavirus, what they're calling the COVID-19, a pandemic. And I think that is a major tragedy to not only the countries that have confirmed cases and are infected, but has put the entire world population at risk. But let's see what they were supposed to do in phase 5 and phase 6. They were supposed to provide leadership and coordination to multi-sectorial resources to mitigate the social and economic impacts. Well, I'm going to tell you what. They've been mitigating them since the very onset. That is the one thing, all the actions, what few there was, to include no recommendations of travel bans or restrictions, was to mitigate economic impacts. They did not want the global economy affected or any other countries economy infected, and that is quite clear what they haven't done to this day. Then it says here, actively monitor and assess the evolving pandemic. Well, haven't done that because they have yet to declare that this coronavirus is a pandemic. Then it says here, continue providing updates to general public and all stakeholders on the state of the pandemic and measures to mitigate the risk. No, that ain't happened today either. Implement individual, societal, and pharmaceutical measures. Nope, not a word. And then implement contingency plans for health systems at all levels. Nothing here across the entire scope of what they were supposed to be doing at a phase 5 pandemic level or phase 6 has been announced or has been implemented. And that's where we are today. As of Sunday, February the 23rd, not only the WHO, but our own CDC here in the U.S. have yet to declare the coronavirus a pandemic. What they have done, as of this past Friday, they said we may be on the verge. We may be on the very beginning. And the WHO said in their Friday's press conference, the window for containment was narrowing. They came out with that same statement Saturday, that the window for containment they feared was narrow. I don't know about you folks, but I think by now I've shown you that window for containment went out the window way back in January. So let's switch gears and look and discuss where we are right now compared to where we were in the past. So friends and family, here we are on February the 23rd, 2020, and this is present time. This was last updated at 4:33 p.m. today. It's now 5:15 p.m. And we can see right here, total confirmed cases worldwide, 78,971. Total deaths, 2,468 worldwide. 33 different countries now have confirmed cases, several of which over the last 3 to 5 days have just blown up. Numbers have skyrocketed, and we'll be talking about that. But the one thing I want you to see right now is this global map and all the countries it's in. But here again, as of Friday and this Saturday, it's still not a pandemic. I don't understand how many more confirmed cases we have to have, or how many more people have to die before this is declared a pandemic. And why are we not declaring this a pandemic? That's painfully obvious. And it's just like what we showed you in one of the phases over on the World Health Organization's pandemic descriptions. Mitigate economic impact. Yes, folks, it's all about the economies of countries and the global economy at large. It's all about the money. It's not about human lives. It's not about mitigating human lives and suffering. It's about the almighty dollar. But while we're here, I want to show you another thing too, because you might have been encouraged here of late in the last few days. The cases in China have came down. And that, oh boy, our mainstream media has picked up on that. And why is that? Well, if you remember back here, you look over here in the lower right hand corner on the 13th, when the cases shot way up, did a video on that, and I told you it'd be interesting what would come out the next day about it. Well, what came out was China started using a different method for reporting confirmed cases. Prior to the 13th, supposedly, per China, they were only using confirmed cases that had been confirmed via laboratory results. On the 13th, they decided to use clinical diagnostic cases as well. And what I mean by clinical diagnostics, what they were doing, they were looking indeed, did you have the symptoms of the coronavirus? Did you have deep pneumonia? Did your nucleic acid test confirm that you did? And if this clinical diagnosis was consistent with all the past cases they'd looked at, and understand, by the 13th, China had tens of thousands of cases that they had looked at, that they had researched. So by all means, they knew what the coronavirus looked like in people. So they started including those cases. And on the 13th, they put in 15.1 thousand more cases. But it was what happened the very next day when they did this. This shocked the financial markets around the world. Bad thing, right? It shocked the Chinese stock market, Japanese, the U.S., and any other stock market there was in the world. Here again, that gets back to some of the priorities here of not only the WHO, but each country's government and health agency, and that's to mitigate the economic impact. Save the money before saving people. And you can see here, we're on February the 14th, where this was cut even below half, 6.5 thousand cases. And then it stayed down in the 2000s, 1.5 to 2,000 range, up until the 18th, and then on the 19th, it dropped even more to 489. Well, some other changes took place between the 13th and the 19th. One of those was China enacted what they referred to as wartime measures. And what that meant was they actually put into place the equivalent to martial law. And they ordered their population, as many as 760 million people, to remain in their homes, quarantined for 14 days from that day. That's what they did, and that's what they meant. And many mainstream media outlets, they reported on China enacting wartime measures. But none of them ever asked the question what that actually meant. What it meant was, for these people and these families, they would remain indoors for a period of 14 days. And somehow food and other supplies would be brought to them. In some instances, one person could be designated and allowed to leave once per week to go out and get food for those who are quarantined in their homes. So this is drastically, between those two measures of discontinuing how they were reporting cases on the 13th to enacting the wartime measures, has drastically reduced the number of reported confirmed cases. But is that actuality? Now that 760 million Chinese are basically held up in their homes. Now China has said they've got community people going around and checking temperatures of everybody. Now I don't know about you, but I think that's pretty much totally impossible. With 760 million people quarantined inside their homes, that's over half of the Chinese population. There's just not enough people to go around and do that every day. I'm sorry. Not believing it. But from the very start, nobody has believed the numbers China has put out. But even so, all of this said, there's still no pandemic in the world today. So now I want to switch over to the Worldometer site, where we can look at each individual country and what's going on there as of today. So now we're at the Worldometer site that also tracks the coronavirus, and You can see the numbers are similar to those over at the Johns Hopkins website. There's 78,993 confirmed cases. Deaths are 2,470. Recovered 23,419. That's a good thing if you're one of those. So down here, active cases, 53,104. 41,535 of these, 78% are in mild condition. Here again, another good thing. But the serious issue here is 11,569, 22% of the active cases are serious or critical. Now understand, the majority of these cases are still in China. Now ask yourself, if this broke out in your country, could your health network and infrastructure take on 11,569 cases in the hospitals? I know here in the U.S., and we're considered to have one of the best healthcare systems in the world. I don't necessarily agree with that. I don't think even we can deal with 22% of all coronavirus cases being in serious or critical condition. It's quite concerning. Closed cases, 25,889. 90% of which are either recovered or discharged. 10% though have died. So we're going to come down here and we're going to look at how these numbers are for individual countries. Here we have China. They reported new cases today of 652. Now if you've been following along in my videos or keeping track of this yourself, you'll know that's considerably less. But like I said, there are reasons for that. They have really stepped up their quarantines. What they have imposed now encompasses over 760 million people. Half of their population is now quarantined inside their homes. Think about that if that was in your country. But even so, today, they've had 99 new deaths. Now the Diamond Princess, the cruise ship, sitting there in port, Yokohama Harbor in Japan, that's been a major tragedy. And as of today, 57 more new cases. 3 people have died, all in total, including 1 today. But the first thing we want to talk about is a new outbreak, and that's in South Korea, which is now at 602 cases, reporting in with an additional 166 just today. They've had 4 additional deaths with a total of 6 now. So if you want to understand how that's all blown up, we're going to scroll down here real quickly. And this is an alert page that shows you the progression. And it's important to understand this so you'll know how this may transpire in not only the U.S., but whatever country you live in. On February the 18th, South Korea only had 31 cases. On the very next day, they had 58 cases, nearly doubling. On February the 20th, 111, nearly doubling again. On February the 21st, they were up to 209, almost doubling. February 22nd, 436 cases. It actually did double. Now, February the 23rd, 602 cases. They got a little note off to the side. Day still in progress. Now they have raised their alert level to the maximum, level 4 serious. What's coming out of South Korea right now is they're calling it red alert. The highest level the government can put towards this, that they are saying is a national health crisis in South Korea. And they have already locked down 2 cities. And most of this stems from what is called a super spreader that actually attended a church in one of their cities, and there were 1,000 people at that church when she attended it. And more than half of these 602 cases are from that one church meeting. Now bear in mind, the other half are spread out across several other provinces in South Korea. So this has become a great concern. South Korea is now the second country with the highest, most possible cases outside of China. And it's all happened, as you can see, within the course of 6 days. So, we're going to scroll back up here. The next country that has really shocked the world is Italy. They're now at 157. 78 new cases today. They've had 1 new death today for a total of 3 total deaths. And this is also the Italy outbreak alert. And you can see right here, just over the last 3 days, this is totally blown up in Italy. And what makes it even more important, they can't tie it back to anybody who directly traveled to China. There's no what they call epidemiological link. They don't have a clue who the patient 0 is. They're searching for it. They just don't know much about it. But it's totally blown up in Italy. They've had 78 new cases so far and 1 new death today. There's 112 new cases in Lombardy, and this just progresses. 27 more in the Veneto region, as well as 3 other regions. They've got now 11 towns, 50,000 people placed in lockdown. And what they've also done is they've enacted their armed forces and police forces to be mobilized to form an insurmountable health belt around the contagion areas. Roadblock violators risk up to 3 months prison sentence. So they've actually cordoned off this area of 11 towns with the military and the police. Schools are closed. The Carnival in Venice was canceled. All public and private events have been canceled. And now, we're going to get down here to a couple of different quotes. And the first one is, I think these 3 cases that have no contact with a primary carrier show how this virus is now ubiquitous. So as with the flu symptoms, you can get it. You don't know who you got it from. So they don't even know. Apparently it all started with 3 people. But nobody knows how those 3 people got it. Now down here, in the second quote, and I think this is even more telling because this gets back to that wonderful health organization known as the WHO. Serious mistake was made not to quarantine people who arrived in Italy from China. And that was said by Walter Riccardi of the WHO, adding that within 2 weeks we will know if we are facing an epidemic, and advising that for the next 2 weeks people should avoid crowded places, metro buses, trains, schools, discos, and gyms. Well, if the WHO back on the 27th had recommended travel restrictions rather than not, and saying there was no need for them, well, maybe, just maybe, Italy, South Korea, and so many other countries wouldn't be about to see epidemics within their borders. But the next country in line, Japan, now at 146 confirmed cases. They've added 12 more today. Singapore, and Singapore is something I want to talk about right here. They're at 89. Now I looked at the information. For the 3rd day in a row, Singapore has reported no new cases. Now some of that has been attributed to the fact that Singapore took very early measures to quarantine everyone initially and advised them to stay indoors. And for the most part, based on all the videos I've been watching a lot out of Singapore, they have done that. But another most interesting thing is, and I told you about this, about viruses in general. Normally, with all the viruses we've looked at, with the exception of MERS, and this is especially true with coronavirus, here again, with the exception of MERS, their survivability in the environment decreases as temperature and humidity rises. And right now in Singapore, they're currently at 80 degrees. Their 14-day forecast out projected has got them in the mid, high 80s starting Monday, and for the remainder in the low 90s. And it'll just be something to see how Singapore plays out. Hong Kong's at 74. They've seen 4 additional cases. But the third outbreak that has pretty much shocked the world has been here in Iran. Now with 43 cases, they've added 14 today. What has bothered the world so much about Iran is not the fact that all of a sudden in the last 3 days they now have went from 0 cases to 43, is the fact that they've had 8 deaths. 8 total deaths. They added 2 more today. And what many experts that I've watched here in the last 2 days is starting to wonder, has this coronavirus mutated and now has mutated to a much more deadly strain? And that's something we're going to have to watch carefully over the coming days. So now what we're going to be discussing is the good old US of A. And as you can see, 35 confirmed cases. 7 are recovered. That's just amazing, isn't it? And that just sort of popped up here, I believe it was yesterday, 7. And the 35 is of some concern as well. Now if you remember, for the longest time we had 15 confirmed cases in the U.S., 3 of which were recovered. The one young man in Washington State and 2 in Chicago, Illinois. And that's the way it was. Well, at least it was until we decided to evacuate 329 people from the Diamond Princess, and we brought them back to the States. And while they were in transit, while they were actually on the bus heading to the plane, Japanese authorities informed U.S. authorities that 14 of those had actually tested positive for the coronavirus. The test results that came in. But at that time, our U.S. State Department decided to just continue on and bring them home as well. And I will say this right now, I totally agree with that. If I would have been one of them, or any of the 329, I would have wanted to come home too. Because the Diamond Princess was a total debacle. Total tragedy. So, if you would have took the 15 that we had, and the 14 that were coming in from the Diamond Princess, that would have put us at 29. And actually, just a couple of days ago, that's what we were showing here on World Meter, as well as the Johns Hopkins site, 29. Then, on Friday, magically, we dropped back to 15. And the reason for that was the CDC decided that they would start counting those that were infected from the Diamond Princess cruise ship differently than those who were actually confirmed in the U.S. But that raised a stink. People started questioning it. And then by yesterday, Saturday, they popped back up, and now we're at 35. But there's a couple of things you might not know. Now, here again, this gets back to who are the 4 additional people that recovered? Who knows? I've searched and searched, and maybe some of you know, and I can't find out. I cannot find a news story saying anything about it. But what's more surprisingly is what I'm going to show you now. So we had to scroll down a bit, so just bear with me. We're down here to February 21st, which was Friday. And we'll come down here to the bottom, and you're going to see right here One new case in the United States in Humboldt County, Northern California. A close contact who has symptoms is being tested as well. They are both doing well and are self-isolating at home. And that's an issue we're going to be talking about more as well. Then, if you come on up here, you're going to see another thing. You're going to come on up here on the same day, February 21st, and we have another new case in the United States in Sacramento County, California. The individual has returned from China on February the 2nd and has so far shown no symptoms, but he still tested positive for the coronavirus. There's no telling how many people this person has infected, since we now know that asymptomatic people who do not have symptoms, are capable of infecting others. But more importantly, there's your 2. So we had 15. We now had 14 more from the Diamond Princess, which put us up to 29. Now we have these 2, which is at 31. Where did the other 4 come from? Well, if you look down right here, you'll see there were 7 new cases in the United States from the Diamond Princess, in addition to the 11 previously confirmed. Now see, this is where the numbers get all messed up. It was reported that 14 were infected by Japanese authorities while they were in transit to the U.S. Now what the CDC went ahead and did, they retested these 14. And they come back and said only 11 of them were infected, not 14. So, we had the original 15, we add the 11, now we got 26. Okay? But the total now is 18. So you got to take the 15 and the 18. That brings you up to the 33. Then the 2 new cases that were shown positive here in the U.S. brings it to a total of 35. I hope all that made sense. And all the time, I haven't seen the first news story saying anything about this whatsoever. Nothing. I also listened Friday to the CDC's telebriefing. And this is done by phone. It's about an hour long. They didn't say anything about it. The only thing of consequence they said during the telebriefing, and you can go listen for this yourself on the CDC website. If I can find the link for it, I'll include it below the description in the video, was that they feel that we are about to see a spread of cases in the U.S. That's very likely, and that we are also likely globally to be seeing a pandemic. Nope, still not a pandemic though, so don't panic. Don't get afraid. So y'all, what I want to talk to you about is just my thoughts right now. And this is my thoughts. First of all, this was a pandemic back on January the 30th. And if it wasn't a pandemic then, it definitely was a pandemic by the World Health Organization's description as of February the 3rd. Now, I understand, I get it, why they don't want to declare a pandemic. Why the CDC here in the U.S. doesn't, or the European Union CDC, or any of the health organizations in other countries around the world. The why is simple. It is going to have a huge economic impact globally and on every country affected across the globe. There's no doubt. It's already having tremendous economic impact in China. It's about to have a tremendous economic impact in most of Asia, as well as North America. Because, like many of you know, China has become the factory to the world. Should we be putting the almighty dollar over the value of human lives? I don't think so. But I think what not only we are doing here in the U.S., which is total insanity, but in many countries in the world, we are simply allowing citizens to become at risk and to have to either go through the coronavirus. Some will survive, some will not. And if you're like me, an older American, or older in your country, your chances start to quickly fade, especially if you have other pre-existing health conditions. And I would hate to think that that was the whole motivation to start with. That would totally be horrible. But it's not out of the realm of possibilities. For in my mind, if you were wanting to reduce the population of the world, what better way to do it than with a virus that only affects those that are older, that are reaching the years where they're going to be the least productive, they're going to be the highest drain on society, and cost the most to the countries they live in. And that's how far too many people these days think about older, elderly, and senior people. It's just a fact of life. You can see it every day in how the mainstream media portrays the coronavirus. They're always more than glad to point out that it affects the elderly and those with pre-existing health conditions the most. Those younger, infants and children, not so much. It's a sad state of affairs that we have in humanity these days. But I wanted to bring this all to you to show you just what my thoughts were. And to ask the question, when is a pandemic really a pandemic? Well, like I said, I think we're far past that. I also believe we're far past the point of containment. And I predict that more countries than South Korea, which is in full red alert right now, as well as Italy, and probably about to be Iran, we soon, America, will be heading down that same trail. And I, for one, ain't looking forward to it. And I know many of you aren't either. But I'm sure you'll give me your thoughts in the comments below. I hope all of you are preparing as best you can. And please make the appropriate decisions for yourself and your loved ones. And until on the next video, y'all take care. Stay safe. And God bless each and every one of you. Goodbye for now.